I am a peer ambassador, and that means I volunteer to go out in the community and just tell people about all of us, what it is, why it should be of interest to them. And that's kind of why I'm here today, is just to be a spokesperson for all the things that all of us is trying to get everyone in America to understand. And since I am a senior citizen, that's the part of the population that I try to help understand what all of us is. I have a personal interest and experience in understanding how valuable research is. I don't think there are many people living today who haven't benefited from medical research that has helped keep us alive. Since this all of us publicity is not seen in broadcast commercials to get the word out, it's the peer ambassadors reaching out in community one-on-one personally. That's how we get people to know about it. I'm retired and I have time to do volunteer work like that, and I'm very happy to be part of that. And I will say it has been productive. Our goal is to get 1 million people within 10 years, and we're maybe 4 to 5 years in, and we've got half of that. So we've kept on track, and the system seems to be working pretty well. I am presently enrolled in a Alzheimer's research program at Vanderbilt, and that's a long-term program where they follow senior citizens year by year to watch for signs and see if Alzheimer's does develop, look back and see maybe what happened to start it or when it started. So I'm still in that program. I would love to be in more health research programs. I think it's very important, and I enjoy being part of that. I will say this, because I can speak since I am an older person. My body has changed a lot. And for example, when I was in my 30s, any medicine or drug that I was given then that was appropriate and maybe worked very well and didn't have harmful side effects, the way my body has changed, that may not be true now. So when researchers are looking at all the data that we collect, and they can pull information from senior citizens, and they can start testing and looking at, well, yeah, this may have worked when she was 30, but maybe her heart's not strong enough for this now, or maybe there's a chance it would cause a stroke now that she didn't have before. So they have to look at that. That's important. So that's one factor. And another factor that motivates me is that I'm thinking ahead to the future for my children and grandchildren. And I think most older people who are grandparents do that. How can we leave the world a better place for them? What can I do now that may help researchers develop cures and treatments that I don't have, but they will get to have? That will benefit them, and that makes me happy. So those are some of the things that I think about that older citizens should also consider. Well, we see these people all the time when we're out in the public, and they have a lot of questions and concerns, which is good. You should have. They can always contact some of the peer ambassadors or the staff that we have to answer their questions. Their questions need to be answered first, yes. This is really important, not just for you, but for whatever communities you are a part of. All those communities need to be represented. And if we can't get a variety of people included in the research, not only are you personally not going to get critical medications that fit you, but your whole community will fail to get the cures they need. That's the important thing about all of us. We're trying to get past that one drug for everybody, because we know now that is not the best way for many people, that health will work best. Go to our app and there are videos there that explain in detail English and Spanish speaking. It's joinallofus.org/50forward. Or if you don't have a computer or don't like getting on a computer, you can call this number, 615-743-3431, and we can set you up with one of our peer ambassadors like myself, and we can make appointments and talk with you, explain things, even help you enroll if you want to, if you can't do it by yourself. So any help that's needed, we have ways to get that to you.